Video game characters. Head wound, bandage on the arm. Today we are back at it, breaking down and reacting to all of the hilarious medical memes that I am told only gamers will understand. All right, let's dive right in. What body type are you? Ectomorph, mesomorph, endomorph, and necromorph. Nice. Necro meaning like death or corpse. I'm an ectomorph, but basically it just has to do a general description of your body type. So no, I don't think there's any necromorphs out there, and hopefully we don't see any in our near future. Testing fall damage. I know the controllers. That's a PlayStation controller, and it is found to be in a rectum. You don't fall on objects and they end up there. They are placed up there with purpose and take actually a little bit of time to coax up there. So if you do actually end up getting a foreign body in your rectum and you can't get it out, please come to the hospital and we'll help get it out. Sometimes you can actually push these out as a normal bowel movement, but the concern is bowel perforation as well as obstruction. Me goes to bed. My nostrils. One's open, one's closed. Interestingly enough, with our nostrils, sometimes it actually has to do with our parasympathetic and sympathetic nervous systems, aka our autonomic nervous system. And also sometimes we have a more dominant side or nasal cycle where we only typically more often breathe through one nostril over the other. Do you guys have a nostril that's dominant? Let me know in the comments. Doctor explaining a bunch of technical stuff to the nurse. Me, who came for a bellyache. The doctor explaining a bunch of medical jargon. Sometimes patients are like, what the heck is going on? Sometimes we explain things medically because it's quick and fast and a little bit easier. And a patient may ask, hey, can you explain that to me? You know, the easiest thing is just to have a conversation with your healthcare provider in that situation. PostNut Clarity, coming to my senses. I'm guessing the bottom one is more like the release versus the top one is more just like afterwards, like chilling. And again, it has to do with your autonomic nervous system, which is quite normal to have different types of reactions during the process and then thereafter. When your cat jumps on your knee during a horror game. So you're totally into the horror game, you're playing, and then all of a sudden you got a cat jumping on you, didn't expect it. It's like, oh my gosh, the horror has come to life. Tachycardia, blood pressure going up, sweating. These are all normal reactions to the horror of feeling like the anxiety, which is the normal reaction in those situations. Oh my gosh, 1 year after online classes. Not likely for that to occur because your bone is fused and it's not melting away due to that type of compression. Traumatic injuries to the brain can cause this, where you've had previous surgeries to the brain can cause this. How doctor listen to music. No, we don't do that. But that is quite funny. I'm like, oh, wait a minute. There's a stethoscope. It doesn't work as well as you think, but yes, you can actually hold it up and hear conversations. You can hear music through it. Most people think we just use it to listen to the heart and the lungs. We also listen to the abdominal sound. We can also listen to your neck. Bro, this baby took too much perk. Now he purple. Okay, no. So when people refer to perk, they're talking about Percocet. Percocet is basically Tylenol plus oxycodone. Oxycodone, it's an opiate. We use it for pain control. Again, any type of pain medication treats receptors in the brain relating to the mu receptor, doesn't actually heal. The HIPAA police, kicking but taking no names. Kind of funny. HIPAA is basically like compliance laws having to do with like patient identifiers and confidentiality. No names. Pretty good. If you say there's a case that is so rare that just talking about the case is actually the identifier itself. So you have to be careful. We take lots of compliance courses and regulatory things to make sure that we're all up to date. Dr. Salvador, Resident Evil. Okay. I don't believe that man has ever been to medical school. There have been cases in the United States where people pretend to actually be real doctors and actually have medical practices. You can actually look up your doctor to see if they went to medical school. You can also look them up to make sure that they have a board certification. In Toy Story, if I recall, didn't they have the creepy neighbor that tortured toys? Maybe he grew up and he's Dr. Salvador. Shot in the leg, remove bullet from arm. Far Cry. Anytime you get shot anywhere in Far Cry, it always ends up in the arms. If you are shot with a bullet, very hard to get out. There's this whole thing. Me and my wife Jen, we giggle all the time because she notices it in movies now, where they always pop the bullet out and the bullet's out and the patient is fine. No, the bullet is like the least of our worries. It's what the bullet actually did to the tissue. Don't feel well. Okay, breathe in. Sharon, send in my next patient. I love that the doc's got the, the make-believe mirror on the forehead that nobody uses anymore, and the stethoscope. We actually try to stay kind of away from patients when we're actually using the stethoscope, because most people actually turn and face us and breathe directly in our faces. Jigglypuff, doesn't that character eat a lot of stuff? And that's kind of why the doctor miniaturized and went into his mouth. Do you guys want me to react to a Pokemon situation? Let me know in the comments. A new toothpaste comes out. Doctors?
1 hour later.
Oh, because like 4 out of 5 dentists agree, there's one that doesn't agree here.
That's right, Doc.
Brush your teeth multiple times a day. Good for you. Maybe if you're able to, make sure you brush your teeth after eating. We do get dental emergencies that come to the emergency department. A dentist can't operate or do anything if there's an infection in the mouth, because if they start moving around, they can reseed it and get into your bloodstream, and you can become septic and get super sick. Video game characters, head wound, bandage on the arm. If you have any type of wound, you need to stop the bleeding. So put pressure on it and then put a bandage on it. Get somebody to see it if it's a big gaping wound. He protect, he attack, but most importantly, he need his hand back. What? Please remind me what game this character is from. If you have your hand accidentally shot off or chopped off, if it's around, grab it, put it in your pocket, take it with you, wrap it up. But then you need to control the bleeding. Direct pressure first. If that doesn't work, then that's when you potentially are going to use a tourniquet. If you have a finger, a limb, something that is lost and you have it, you want to cool it down a little bit. Maybe put that in a bag. Don't do it directly on ice because it can cause frostbite or frost nip. Healing in Resident Evil, the initial ones, and healing in the latest ones. The early on Resident Evil games, you would have like herbs that were like compressed down into a tablet and you can eat them. But now the newer games, you have a water station. There are good herbs out there that do have medical properties to help with certain ailments. You just want to make sure that you're taking it from a reputable place, you're knowing what you're getting, and if you're taking any medications, to make sure that there's no interaction with them. Do you guys take any supplements? Let me know in the comments. Who needs a medical license when you got style? Nowadays, we all kind of wear a cool mask. I actually have not just like the regular surgical mask, the N95 mask, but I've had some other masks that literally look just like that with different filters. But no, my outfits are not like that. I don't wear the white coat, but I do wear scrubs at the hospital, probably either blue or black. These were actually a lot of fun to check out because I knew like more than half the games in these. Again, allowed us to talk about some cool medical topics and things that I deal with on a daily basis. So I hope you guys learned something. If you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn those bell notifications on, and hit that like button for me. Appreciate it. Thank you so much for watching, and stay healthy, my friends.